Hi everyone, this is Emma Lord from Capacity and you're listening to the Fundamentally Different podcast. On today's show, I'm joined by two guests to create some space for discussion around children and young people living at the edges of care in Cheshire and Merseyside. In children's services, edge of care typically describes children and young people who are at risk of entering the care system but have not yet been placed in either foster care, residential care or any other form of statutory care. It's a group of young children and young people whose circumstances really vary and factors such as family breakdown, neglect, abuse and other vulnerabilities are playing out. Without help, these children and young people are likely to be pushed into the care system. This is a growing population in Cheshire and Merseyside, and today we're joined by Nasima Patel and Carly Brown, who spent their careers working to drive improvements in this space. Nasima is Strategic Lead for Change and Improvement, working across 9 local authorities and the NHS in Cheshire and Merseyside. She's a former NSPCC Director and Board Trustee of the Children's Society. Carly is Strategic Improvement Partner for Children and Young People Services at Liverpool City Council and is also a Governor at Alderhay Children's Hospital. There's a real sense of urgency in the region around edge of care. People are talking about this population and scratching their heads. But before we get into what's not working here, we've got a couple of questions around kind of who are this cohort that we describe as edge of care. So Nasima, I wonder if you could kind of explain what that population is, who they are, and particularly in the context of Cheshire and Merseyside.
Okay, so I think you're quite right to describe edge of care as in the way that you have. What I will say is that it's quite a generic term. It's not that forensically defined, but generally practice understanding of edge of care is children who've been assessed at being at the point of coming into care. So somewhere along the line, a senior social worker has decided that actually, unless we take quite specific, decisive action to disrupt this child's journey into care, that child will enter into care. Typically, the cohort we tend to work with tend to be adolescents, and they tend to be, in terms of gender, they tend to be mixed for different reasons. Typically, the edge of care cohort, in my experience, and Callie may have a different experience, they tend to have individualised safeguarding risks themselves. So it's not just a family situation that could have led to some difficulties. It's often because they may be putting themselves at risk as well. So there's some sort of gaps in the way the families can protect them, and that tends to require some specific intervention. The interesting thing about edge of care services is that a lot of the interventions they do, you probably would see in generic social work, but they're quite intentionally designed in a particular model based on quite a lot of understanding of how families function, communicate or don't communicate, and what helps adolescents stay safe in terms of harm minimisation, having a trusted adult relationship, a good key worker, and then having access to specialist services around that. So it's a team around the family approach. Some edge of care services are quite innovative. They may have a bit of residential respite as part of it. Mm-hmm. They tend to be multidisciplinary. And the best ones from research indicate that co-location is really important for professionals and possibly access to a clinical psychologist or some clinicians within that space. So you have a culture of reflection and quite slow work with families for them all to really engage in whatever interventions has been individually designed for that family.
Sure. Okay. So there's something playing out here that is both individual, so the child or young person, and within the family, and trying to find the help for both of those.
Yeah, it's the recognition that actually it's families that really can care and protect children, and if we invest in that unit as well as the young person, then the chances of them staying out of care are probably higher or greater. The other interesting thing, I think, is some edge of care services actually do work with children in care to return them home. Mm-hmm. And that could be because they've had an emergency admission. Yeah. So they do a quick wraparound to return them home quickly. Or because, again, the local authority might have decided that we've actually got a lot of young people in care who actually are orientating back to the family, so need some deliberate work to get them back safely as well.
And do you find that health and social care have the same understanding of this group of children and young people?
Not really. I think they'd come to a common understanding through discussion and dialogue. So one of the interesting things for me, and I've just come to Cheshire and Merseyside, is this notion we all describe a lot of these young people having complex needs. So when I've spoken to health colleagues, their understanding of complex is different from ours. It's very much around mental health diagnosis, and ours tend to be around the experiences young people have had, which actually are quite distressing. So sometimes the word distress young people is probably more accurate. They tend to come from more trauma-led backgrounds. They may not have diagnosed mental health. So I think there's some work to do around definitions. The nice thing about Cheshire and Merseyside, which I can thank Carly and the others who've done a lot of pioneering work, is that we're all in the same room wanting to have the discussion, wanting to come to a shared understanding, and very open about the fact we don't always understand each other's language, which is really good and interesting.
Okay, so kind of easy to say, edge of care, tricky to define, and lots of variation in there. So, not one homogenous group, and we've got both need and opportunity at individual and family level, and that need spanning health and social care challenges.
Yeah, it tends to be around family communication breakdown, and it tends to be about adolescent risks, in my experience, in terms of practice, really.
Yeah.
Those are the things that really need a lot of attention through edge of care services, really.
Thank you. Thanks, Nasima. It's brought a bit of texture to that heading of edge of care. Carly, I guess bringing it into a place, so Liverpool, why is focusing on edge of care crucial for improving outcomes for children and young people?
Yeah, I mean, that was really helpful as Nasima just outlaid the wider context. And to your point, Emma, as well, we're very good as a system putting labels on things, children at the edge of care, but what does that actually mean? In a place like Liverpool, it's absolutely critical that as a system we convene together to address some of this, because it's not one independent issue that causes a child to come at the edge of care or their family to have, certain issues and challenges. There's often, a range of different interdependent issues, challenges that child is facing, and particularly if they've been exposed to adverse childhood experiences, 4 out of the 7 factors, it's a cauldron really of, issues really to address. And often as professionals, and for the safety of that child is, it's trying to offer a more, a more risk-averse option really to put them into care.
Yeah.
When actually, if we looked at the system differently and looked at what other interventions, services, support, different family networks you could look at, the outcomes could be much different. In Liverpool, we've got a 110,000 population for our children and young people up to 19, 0 to 19, so that's not spanning 0 to 25. 0 to 18, we've got 110 children. We've got a looked after population of 1,500 children. That's just, for me, is, unacceptable.
Yeah.
We tend to focus on that number of 1,500 when actually the number of children at the edge of care is probably in the region between 16 to 17,000. So think about that in terms of scale is why we need to ensure that we explore and work differently. We know 80% of our children's services budget is focused at the high end, so we're actually paying for poor outcomes, we're paying for that intervention. And if we can reconfigure some of that funding and finance into early help and prevention, we can stem that flow of the 16,000 to 17,000 and improve their life chances and outcomes.
Wow. 16 to 17,000 children and young people. That's a lot.
It's a lot, and it's probably a hidden population as well that's not presented, that don't perhaps just meet the criteria as professionals we do. We know child poverty is on the increase, the cost of living, the wider challenges that the pandemic has brought. So we've actually got a situation that could implode, I feel, as a professional in children's services.
The figures, if you don't mind me, are so different from London. So the last one of the local authorities I worked with, 85,000 children. The child in care population was hundreds, and the edge of care was hundreds. So London and the South, but London in particular has bucked that trend really. So if you look at the recent reports, the northeast and northwest come up really high as the numbers of children in care per 10,000, and therefore the edge of care services do need a lot of attention. What can we do in this space to prevent that? So it's 93 per 10,000 in the north. South is about 60 per 10,000. In London, it's about 55. So there's been a lot of, there's quite a disparity that needs looking at really between north and south in this area.
So, looking at Liverpool City region, Liverpool, Cheshire and Merseyside, what's not working in this space?
Wow.
From a local authority point of view, from a local the council, the city place shaper really for these services, it's really, really difficult. We're in really difficult financial challenges as a local authority. And we know that people services, so like children's, adult, public health, take, between 67 to 70% of revenue budget. And when you think about the services that local authorities provide, and they've still got to provide those services, it's really, really difficult then in terms of investing in some of that early help and prevention, when intuitively we all know that's how you're going to turn the curve in preventing children coming into the care system or children coming to educare services. So it's that constant challenge really. And so until something happens nationally in terms of the way this is funding, I think that's a real challenge, not just for Liverpool, but for all local authorities. So there's the financial challenge to do that. I think linked to the finances is also that a lot of the money is associated with early help and prevention is grant funded. So you don't get the sustainability. There's a lot of short-term projects. There's a lot of short-term funding. And although the evidence will say this is having an impact, this is making a difference, there's not the sustainability. Okay.
That's so true. Family Hub money, for example, is going to run out next year. We've got a new government. We're still waiting for assurance that it'll continue, even though most people, including the government ministers, will agree that we do need a lot of work in that prevention space. I think the other difference I've noticed from the London authorities and Cheshire and Merseyside and the northern authorities is the role schools play. The school improvement was such a big intervention in London around the London Challenge. About 20 years ago, there was a very conscious effort on behalf of school leaders and regional government to really improve schools, and they've sustained that improvement. And Northern leaders quite rightly will argue that London schools get more money, and that's right, per child. It's what they do with the money as well. And schools have improved, and they do offer, they used to offer a lot of pastoral care. Now, if I had a London school head teacher here, they'd say the same as a Northern head teacher, really struggling with budgets, really struggling with recruitment, retention. But the baseline in London around schools is better because they've had that improved capacity for longer.
So I guess what I'm hearing from both of those is nobody's arguing that this isn't something that we should be doing, but there isn't the space and the resource to reimagine how we might do that. The front doors are there's a big queue at the front door, and we have to respond to that, which just prevents any time to be able to look at a different way of doing things.
I think just on that point, Emma, for me, I think sometimes we wrap ourselves up in the bureaucracy and the governance and the sort of accountabilities, which I absolutely understand, they're there to keep us as professionals safe, but also to ensure the child and the family are safe. But actually, some of the stuff that could be done could be really, really simple to change these lives of our children and young people, and particularly through our community and voluntary sector, which again, coming back to that short-term funding, the commissioning cycle, grant funding, they just don't know whether they're coming or going really, because you don't have the longevity to do that. And I think I'm a big believer of partnerships, but purposeful partnerships, and they should be at that table as an equitable partner, not somebody that we bring in occasionally, and the local authority, health and the education system think we've got all the answers, because a lot of this could be unlocked within the communities and the neighbourhoods that these children and young people live in. They know them, they know the families, they know their extended families, they know the history of place, the heritage. It's some of that humane and sort of compassion really that I think we need to unlock as well, and give that permission really to move that forward without it being so highly regulated that we're in this, constant revolving door.
But like, what's getting in the way of that?
I think it's how some of the community and voluntary organisations at real hyper local police, are funded. There's not enough money to do that, and all they're getting, a 12-month recurring contract really. So you can't keep staff, you can't, get accommodation, you can't buy the assets required. You're living on a very agile way really, and you haven't got that then the time or the space to invest in those relationships, those children, young people, and the families. Because that's what you got to do. You got to build the trust and you got to build the confidence. I've got a teenage boy at the moment. He's year 10. He's my one, not just somebody randomly I picked up. He's my son, and it's tough.
Yeah,
he's 6'2". He thinks he's older. He wants to go out. He wants to do that. And I find I struggle.
Yeah.
So, and I've got lots of tools and techniques and love and family and, all those things. So layer that with, that life experience with other dimensions. We need to build those trust and confidence with those families, those children, young people, and those communities to do so. And I think there's often a lot of mistrust with the system and professionals coming in. If you reached out to say to, a social worker, I'm struggling, it's often seen that if you make that admission, therefore, your child's going to go into care.
That's right.
And we need to change the narrative and that stigma, because actually there's so much good resource out there to support our families.
I completely agree with you, Carly. And I also think sometimes the way we're organised makes it really difficult to really invest in those families and communities. And we don't build enough capacity in the voluntary sector because we're too busy working in quite a regulated way. And accountability is right, and particularly accountability about money is right. But it becomes so bureaucratic, doesn't it? And it really loses focus. I am really interested in non-professional responses to families as well. I think we tend to bring a lot of families into the system, work with them a little bit and then send them off, when actually we could use that resource to really build their communities. Because it's not only, poverty is not just about individual families. It is about the areas that people live in, what they can access or what they can't access, the culture, the leisure that they can't access, they can't afford. Day trips are really prohibitive. Yeah. So, what I say is for my children, when things get stressful, I used to work out. So I used to be working mum in London with 2 boys, a great partner, but really busy working. And I used to plan my evenings so we could go out to eat when I knew I was going to be really stressed out. I had a hard day and I can go on holiday. I've got weekends away. And a lot of our families, unfortunately, don't have access to that because of poverty.
Yeah.
So we can build those sort of nice family times into those communities. That will lessen some of the pressure, definitely.
You've both talked a lot about trust in relationships, which we don't usually see in strategic plans, but probably take up 60-70% of your day jobs, and a lot of hard working people that are trying to improve outcomes in this space. So as leaders in these places, how do you build relationships and trust with partners, with colleagues, with families? How?
You've touched on it in terms of relationships is the key for me to do that, and often standing in different people's perspectives, with an understanding of what their drivers are and what their conditions are in terms of, the ability to make decisions, the ability to have the required information, their individual experiences. So for me, it's very much about standing in their perspective and not necessarily always agreeing or shifting your perspective, but actually saying, you understand and you can see things, through different lenses to do that. And likewise, you'd expect that to be reciprocal back then in terms of, those partner agencies, your colleagues, your those individual children and families. And then you get a more richer picture of what's happening really to say, okay, it's not just one issue. There's multiple issues, in play here. Collectively, we have the resource to do that. So where are we going to put that resource, and where is it equitable across the piece, really? And ultimately keeping the outcome at the centre of what we're talking about, really. Sometimes you've got to stand down your professional background and, to have shared beliefs and shared values to think, is that ultimately going to improve that outcome for that child?
Yeah. Yeah, and I think it's about consistency as well, not only for families, but for staff, for leaders. Consistent, stable leadership really makes a difference as well. You know, leaders who have a vision and who've got perseverance to see things through will really build trust in the system, actually.
Just going back, sorry, Anna, just on trust though as well. I think what we haven't touched on is often, you know, these children who are on educare are living in families with multiple issues through the adult lens, not just a family. So mental health, you know, domestic abuse, you know, drug and alcohol abuse. Those three we know from fact and evidence base when the adults experiencing that, it absolutely has a detrimental impact on those children and those families. And again, as a system and even the local authority, we do that individually. So adults will go and deal with the adults, children will go, children's services will deal with the children, public health may pick up some of the mental health aspects. And again, we're often a fragmented response instead of a integrated outcome-led response.
Yeah,
definitely. And we've recognised that now, haven't we? And we've recognised it. So how do we make that ambition to integrate and work together into reality? That's the challenge we're all facing, really.
We see that playing out a lot, don't we, across the region, that, you know, individuals and families need help. But to get that help, they need to navigate multiple channels. And you've talked about relationships and trust being essential to enable better outcomes there. We're also working in a system where, you know, for us across Cheshire and Merseyside, particularly across children's, there's been real change in leadership. So there hasn't been that consistency. So that, I guess that's just a bit of a reality check of where we are right now. And so how is it for you guys as leaders working in that space where there's different people, you're trying to build trust, you're trying to build relationships, you're trying to keep focus, but there are different faces at each meeting?
It's difficult and disruptive. So a colleague of mine, when I arrived, said that if we'd had the same leaders 2 years ago, if we had the same leaders now, we'd be in a much more mature space, and that's so true. So it's a bit stop and start, but you have to carry on, and you will leave. Even short-term leaders can leave good legacies as well, and you build on it, don't you? So you learn how to do transitions well. You pick up the mantle. You have people who are a bit agile, and also if they can leave. And also you will get consistency. It does happen. And there's a number of authorities where it's fairly consistent, even in Cheshire and Merseyside. So it can happen. It can be a bit of a medium-term game, not a long game, but it can take a while, really. And I'm thinking Liverpool's going to be stable. I'm happy.
Fingers crossed. I absolutely concur with Nasima there. For me, it is a challenge, the consistency of leadership in children's services. You know, I think the evidence shows that most directors of children's services serve 3-year tenure because it's such a, you know, 24/7, you know, highly pressurised role, you know, and the level of responsibility and risk it carries is absolutely monumental. Nevertheless, you speak to most DCS and say it's the best job in the world because you're changing outcomes for children and young people. As a leader, to lead my workforce, lead my team, is again to understand that, you know, social workers, for example, are exposed to some of the most tragic set of circumstances and have to make decisions about the lives of those children and young people and their families at that point. You know, as a strategic lead sitting in, you know, Q&R building, I don't have that responsibility. But what I do is to make sure that I can offer the best working conditions for practice to flourish, strong supervision and leadership, safe supervision, you know, providing with the best equipment to do so, training, development. So you're offering a package of care, and although social workers are quite a transient workforce, when you speak to them, it's often not about the pay, it's about the conditions that they're working in and strong leadership and the stability of leadership.
And you also invest in your partners as well, because the churn in partnership is probably less at leadership level. So it's really worth investing in partners.
So in terms of creating those conditions for great partnership, for strong, supported, nurtured teams, what are the magic ingredients? You've kind of said, you've said consistency, you've said relationships. What else can we, I guess, counteract that cauldron that you mentioned before to really grow, nurture the people that are powering this change?
I think they have to feel part of that journey to move forward, absolutely. And you have to operate in a very engaging style, really. Sometimes you have to deliver messages that, are difficult, but that's your responsibility as a leader. And sometimes you have to shape and co-design and co-produce services. And that's where you need, that different viewpoints, experiences, bringing together the workforce so they can feel part of that. And that's how they buy into your vision and the set of clear objectives and shared outcomes of what we're trying to achieve. Quite often when you go into areas that require improvement, is the first thing colleagues will say is, we don't know what's going on. We don't know who's who, don't really know where I fit in this place anymore. Naturally humans just want to feel part of that, part of a system, part of an organisation. So again, bringing that from the beginning really, really helps.
I agree. I've worked in a number of authorities, and the containment, the vision, the hope leadership can bring, the stability can make so much difference. And you feel that with certain people and certain leaders, and you feel like you've turned the corner now, because they mean that, when leaders say, I'm going to stay and do this journey with you, people will know whether to believe you or not. They'll know that. So I think there is some quite basic things about good leadership. Yeah. And also I think it's about giving, I think political leaders and government need to recognise that improvement journeys take a while. So you have to give the leadership a chance as well. Yeah. So you've got to get away from this culture of very individualised accountability, which really borders on blame sometimes as well, but things don't progress at the pace that everybody wants things to change at as well, because it's very disruptive. You've had a leadership in an improving authority for a year, and then they don't quite make the pace of change required, and then they move, then you start again. So you're in this horrible cycle, and there's authorities in Yorkshire, for example, who are in that horrible cycle of stop and start. So we've got to be a bit more mature, really.
Yeah, I think as well, it's all very well saying you listen. It's that anybody, listen. It's actually delivering on what you're hearing, and that will build the trust and confidence in the workforce and the system to actually say you're going to do something about that. I think you do have a responsibility as a leader to do that.
Yeah. So with that in mind, the people listening to this podcast will be people working and interested in this space. So, if you had your magic wand or your 3 wishes, what would you be asking leaders and thinkers and doers who are interested, curious, skilled to support Edge of Care? What would you be asking them to prioritise their time towards?
I think it depends. I think nearby leadership is more helpful in this space. I think distant leadership, leaders who sort of comment and give commentary and evaluate at a distance, can be helpful, but not really what frontline workers want. Frontline workers want their leaders to really understand what's going on in practice, to be agile around their demands, not to have a business case culture for everything. So if you need a bit more admin, to sort of take that quite quickly and deliver that quite quickly. So I think it's about really protecting and nurturing the frontline services. I think the other thing in terms of what leaders need to do is really invest in their operational middle managers and give them the bandwidth to do some of their strategic work and thinking instead of relying on external people. Build that transformation, that change DNA, and really create a learning culture. So distant leaders can help really create that learning culture. How can we access learning packages quickly? How can we learn in practice and in time quickly, rather than waiting 2-3 years for a research piece and then a massive program to implement it, when actually the answers are probably about just sort of small changes in practice, small bits of resources here, bit more co-production, things like advocacy and child protection. That's been known about as making a real difference to families. And now it's only going to be rolled out now. Family group conferences, we know that. Sometimes we wait too long for things to scale up, actually. So if you ask me what distant leaders can do, they can find the magic DNA of how you scale up things quickly and effectively, because that's a challenge for us.
Yeah, I'd probably extend that point because I agree. I think if we had that magic wand, it's about saying, giving the permission to bring people together to do something where some of the most simplest interventions are going to have the biggest impact, and then scale up and sustain that, rather than we in this initiative fatigue where we do there's so many initiatives that we actually lose sight of what we're trying to do. And not only from the strategy people or the partnership people, from a cross section of our workforce across the public sector who work with children and families, because that lived experience is absolutely fundamental to do that as a professional as well as the child and the young person. I'd also say not to politicise children and young people and families. We've got a new government. I hope we don't lose some of the theme and the ethos of the McAllister Review, because if you look at some of that, really, it's about what we're saying. Children just need to be loved, and come from stable homes. No, we're not allowed to say that, but that's what they need, and some of the fundamentals. If it's not good enough for our child, why is it good enough for our looked after children? So I hope that doesn't happen, and actually, both even nationally and locally, really, that children and young people services doesn't become caught in that crossfire.
I agree. I think we need a 10, 15-year children's strategy now that can withstand the change of government, really. And I think that's what leaders can do, to really commit to a vision and a plan for children. That's not going to be changed every time there's a different minister, for example, not even change of government.
Great. Okay. So we've covered a fair bit of ground there, and kind of in an effort to kind of sum up the key things that I've heard, it feels like, the children that we describe as being edge of care and their families are being asked to navigate our structures to get help. And we know that that's not working. But we've not got the space or time to reimagine how to do that. When we can, we need to make sure that everyone who is living and working in and around edge of care feels part of designing what better looks like, and are leading what that change is. We've talked a lot about trust, and how that plays out in action. It's easy to say, I'm going to build trust, but we've talked about that being about really understanding what people want, really getting the richness and the texture of that. Mucking in and delivering. Trust and conversations are easy to have. Delivering the work, it is harder. And the consistency to keep showing up and keep chipping away at that bigger vision, and people working kind of beyond job roles, beyond organisations, to commit to what that thing is what we're hoping to achieve.
And can I just say, even in such an imperfect system with all the funding pressures, there's some really good work going on, really good work, which is a testament to the people who are delivering that work. Absolutely. And the families.
Yeah.
Really.
Are there any examples that you'd want to, showcase? Do you want to do Liverpool?
Well, I'm not sure that'd be the right at the moment.
Okay, so I think Warrington, St Helens, Warrington's got really good edge of care services, but also other services at points in the child's journey. So really that investment. And then I think St Helens and the others have got really good investment in the workforce as well. So really invest in your front line. If you want your families to get good service, you have to nurture and build your workforce, really, because they're the connecting point. So I think there's some really good work going on.
Yeah. And
lots of potential for much more work, given the right circumstances and the right conditions.
Yeah, great. I'm sure we could fill a whole other podcast if we focused on workforce. So maybe that's something for us to think about in the future. But for now, that is it for this episode of Fundamentally Different. I just want to say a huge thanks to Carly and Nasima for taking part, sharing your insight and experience so generously. To check out the work that we do at Capacity, you can find all about us on the links to the show notes. And don't forget to subscribe to more Fundamentally Different podcasts on Spotify, Apple, Google, or wherever you get your podcasts. Thank you.
Thanks, Emma.
Thank you.